to other updates, in order to increase the dissemination of information to scientists, researchers, and public health experts, the Africa CDC has established a new information hub on the Global Health Network. The hub is accessible through a link, africacdc.tghn.org. The Global Health Network is a knowledge-sharing hub that facilitates the transfer of knowledge and exchanging methods, processes, and research findings between diseases, regions, and organizations globally. So I think it will provide a very good opportunity, like a one-stop shop for health experts and public health experts across the continent. So I think I'll end it, James, and return the microphone to you.
Okay, a bit of a break with the Africa Center for Disease Control briefing. Let's take you back to the SIU.
We'll go ahead to take your question. So I take this first question from Norbert Hahn from ARD German television, and he's asking, there is a lot of talk about Western vaccine nationalism that leaves Africa behind. How do you see it? That's the first question. Then secondly, he says, what is currently the bigger problem for Africa? That there are still no quotas for the global distribution of the vaccines, or that the supply chains are not yet in place. So he wants to know whether there is no quota for global distribution, or the supply chain is having challenges. The second question is related to that, from Nicholas Barrio from the Wall Street Journal, East Africa office. He says, I want to know, with the commencement of mass vaccination in the West, the stand of Africa CDC, are there any logistic steps taken to get the vaccine delivered in Africa? And how much coordination with the companies or countries producing these vaccines? So these two questions are on vaccines.
So thank you, James, and thank you, Anne, and thank you, Nicola. The issue is clear that before now, we have all talked about the need to exercise global solidarity, global cooperation. And the time is now to begin to translate those words into action, because vaccines are out there, and the vaccination has actually started. I mean, the UK, we all know, started their vaccination program yesterday. What would be extremely terrible to see, I mean, I'd have to find the right word here, is that the world watches Africa not receiving vaccines and see the global north getting the vaccines. I think that would really create a moral issue. I think that there's no word to describe that. I mean, the real word is we get ourselves into a moral dilemma. Many individual Western countries have bought vaccines in excess of their needs, and whereas in Africa, we are still struggling to work with the COVAX facility, which is truly an expression of global solidarity and cooperation. But the truth is that the continent is not going to get enough vaccines from the COVAX facility, for sure, based on our strategic plan, which we have discussed and explained over and over, that in order to secure the health of our continent, in order to ensure that our economies are back and functioning appropriately, and in order to position Africa to reintegrate into the global economy, which requires movement of people, the vaccines become so central. So we find ourselves at a pivotal moment in the history of our continent, where without access to these vaccines in a timely fashion and equitable manner, we will be our whole developmental process will be challenged. So I mean, that is an appeal that the whole discourse around equity, ethics, cooperation, solidarity that has characterized this pandemic and call to action should be implemented now. I think that is one. With respect to the quantities and supply chain, I think clearly that we also find ourselves at a junction where, as a continent, we have never vaccinated so many people at the same time. The vaccines that we all used to are vaccines that are used primarily for children immunization program, what we generally call the expanded programs on immunization. But that is a good starting point. We need to start at that point and say, what else do we need to expand vaccination, so that even if we need to vaccinate 20% of our people before in the next 6 months or so, do we have the right infrastructure in place? And that will depend on the nature of the vaccine. The promising candidates that we have, that is the Pfizer, the Moderna, and the AstraZeneca vaccines, come with their own limitations. The Moderna vaccine and the Pfizer vaccine require stringent storage conditions that are minus 20 and minus 70. That by itself becomes a challenge in the supply chain distribution. But it doesn't stop us from establishing vaccination points in capital cities. Okay, and start with that. I think the key thing is that we need to start. I think rather than get ourselves completely grounded with the logistics of the cold chain, we say, well, in a city like Addis Ababa, can we set up 20 vaccination points and put minor 80-degree deep freezers there and point people in that direction? That would be a start. And that will give us the opportunity to begin the vaccination while waiting for newer version of the vaccines that will probably require that we use less stringent conditions of storage. And I think that's the way we should proceed with these vaccinations, to ensure that we do not, as a continent, sit back and watch the world vaccinate and we do not get vaccinated. With respect to the coordination, I think the two questions were related, so I think I've touched on both. But the coordination is a key piece there. And you all know that the president of South Africa, as the rotating chair of the African Union, has established a task force for vaccine acquisition. So President Ramaphosa has been really upfront, and he's going to call a meeting on the 20th of January at a much higher level to actually discuss distribution and access to vaccines, which is not the first time. I think you recall that on the June 24th and 25th, he chaired a meeting with Chairperson Musa Faki of the African Union Commission. So I say this just to underline the highest level of coordination that is occurring on the continent with respect to vaccine. To also underscore that the continent is not just sitting back and waiting for the vaccines, but the preparation is going on aggressively in partnership with the World Health Organization, Geneva, as well as the World Health Organization office in Brazzaville, and UNICEF.
I'll call on Sophie Mukwena to ask a question.
My name is Sophie Mukwena. I'm the foreign editor at the SABC in Johannesburg. I just want to ask the director, Dr. South Africa yesterday made an announcement that we have entered a second wave of infections. Is the CDC aware? Have you been engaging with your South African counterpart, the CDC level, but also at the health department level? And what impact will this have in an attempt to address the problem of COVID-19 on the continent, because South Africa is one of the second largest economy, and traffic to South Africa is quite huge, and people leaving South Africa to other parts of the continent. And also the fact that at the moment, at that time where many people will be leaving South Africa, going back to their respective countries, are you not worried?
I am. I think I'm in regular contact with the leadership of South Africa. The Minister of Health, Dr. Nkezi, is a wonderful leader, a great public health expert. And we talk all the time, and not just for South Africa, but in his capacity as a minister coordinating on behalf of the African Union, because South Africa is chairing the African Union at this point. So, I mean, what you see in South Africa is a reflection of what I just discussed earlier, which is we've seen a rising trend. I mean, at a much higher level. I mean, if I can just depict the way the pandemic curve has moved, we all recognize that we started off slowly in March, and then it peaked in July, August, and then we're able to rally around massively and bring down the curve, the epidemiologic curve, to around 7,000 cases a day in September, October timeline. But as we speak now, we have seen the numbers increase pick up very slowly but steadily, to the point that my speculation is that by January or so, or February, it will be where we were at the peak of this pandemic in July, August. So I think clearly the second wave is here. Let there be no doubt. Having said that, there are three patterns that we see on the continent. Pattern number one are countries that have never really gone over the first wave. I mean, they continue to see increases. Pattern number two is the category of the South Africa and many other countries in Africa, where they peak around June, July, then they curve nicely, ease the lockdown, and now we are seeing the second wave. And then the third category are those countries that continue to see a decrease, like Ethiopia. We have seen a consistent decrease in Ethiopia over the last couple of weeks. So the key question is, how do we prepare for the second wave? We will prepare for the second wave using the tools that we used in the first wave, but at the same time, hoping that we can get a rapid access to vaccines, so that we can use a combination of public health measures and massive vaccination and timely vaccinations to bring down the curve in the second wave. What we don't know with the second wave is how high will the second wave be. Are we going to peak almost at the same level as we did in the first wave, or are we going to exceed the first wave? We've seen in Europe where the first wave peaked around April with about 37,000 cases per day, and the second wave now is reporting more than close to 200,000 cases a day. So I think so it remains an unknown on the continent what the second wave will look like. But clearly, as I said, in phase 2 of the fight, we have to use a combination of public health measures plus biomedical interventions. We also have to recognize that in fighting the second wave, there will be a balancing act between saving lives and saving economies, to the extent that we have to really count on the cooperation of the community, empower the community, and make sure that there's an increased understanding of basic concepts in the community. Why would people wear masks for so long? Why should people social distance? I think that requires a very deliberate focus so that we continue to win the trust of our community for them to do the right thing. It is only through the community engagement and community reinforcement and leadership that we will be able to fight the second wave. And so what is happening in South Africa is not unique in South Africa, it's what we are seeing across the continent. And I may just add though that we also find ourselves at a critical period where we are going through the holiday season, and there will be mass movement from cities to the remote areas. I think that is also an area that I'm making a strong appeal to the leadership of the continent that we up our public health messaging. The political leadership should really stress that as people go for the end of year holidays, especially to remote areas, to wear masks consistently, wear masks even in family settings, because because you just don't know who is going to be coming and have that infection. We just don't want to come back in January and February with a steep increase in the number of cases on the continent. The death rates are increasing and increasing quickly. So I think that is really a cause for concern, that we need to cooperate again in the same manner we did early on in this pandemic.
Thank you very much. There is a question that is related to that. You mentioned something about it from Andrew Meldrum. He's saying, is there a danger that COVID-19 could become endemic in Africa, and how can that be avoided?
That's absolutely a very good question, and that's what we as a continent of 1.2 billion people have been saying, that unless and until we strive to vaccinate at least 60% of our population, will definitely end up having COVID on the continent as an endemic disease again. And Africa has already enough endemic diseases that we don't need COVID to install and become disruptive and continue to challenge our health systems in the manner that other diseases have challenged that clearly. So our continental strategy, which is championed again by the chairperson of the African Union Commission just yesterday at the press conference with the UN Secretary General, the chairperson of the African Union Commission, Chairperson Moussa Faki, was very clear that we need to strive to get to 60% of of the vaccination of our continent in order to achieve herd immunity, and we have to use the best candidate vaccines to do that. And that's the only way we're going to flush the virus out of the continent. So we really are taking that target seriously and working with several vehicles, financing vehicles, the World Bank, the Afro-Exim Bank, and the COVAX facility to achieve that target. And you heard me said earlier on that the President Ramaphosa, as the chair of the African Union, will be convening a very high-level meeting to continue to advance that course, the need to vaccinate enough people on the continent to eradicate this virus from the continent.
Thank you. Our next question will come from Kolita Wanjohi. She will be speaking to us live. Kolita.
Yes, can you hear me?
Yes, we can hear you.
Okay, Doctor, there's a lot of excitement about vaccine now that the UK has already started vaccinating, and in Africa, we're hearing talks of different countries talking about having direct talks with manufacturers. Is the Africa CDC aware of any individual talks between individual countries and any manufacturer? Then we've also had reports that China is offering to give some specific countries a vaccine if it comes out. So is this under the Africa CDC, or are you aware of such talk? And maybe finally, is the Africa CDC already having talks with any manufacturer? Is the continent already looking at any specific vaccine manufacturer? Because the issue of when it will get to the continent is now becoming an issue. Thanks.
No, absolutely, Coletta. These are very pertinent questions. I think the first thing is that we as a continent have endorsed a continental strategy for vaccine development and access, which is widely known, and member states are aware of this. It was endorsed at the highest level of the continent. It is up to all member states now to adhere to that so that we have coherence in our approach to vaccines in terms of communication around vaccines, access around vaccines, and distribution of our vaccines. If we go alone, countries go alone into this, it will be not productive, and it will backfire for the continent. So our continental strategy call for the whole of Africa approach. That is, we go together as a collective and discuss. And Africa CDC, which is an African Union-owned organization for the 55 member states, is there to negotiate. I've said over and over that the President of South Africa has put together a task force, a presidential task force, which I am a member, Commissioner Mira, Chairperson Moussa Faki, Strive Masiwa, Donna Kaburuka, and others, and with a very aggressive mandate to make sure that we coordinate this effort, get vaccines for the continent, engage with bilateral as well as multilateral mechanisms to get vaccines for the continent. And we are doing just exactly that. We've met with nearly all vaccine manufacturers and have dialogue with them, and some of them are ongoing. and we'll continue to engage with them and bring the results to you all. I think we really want to make a strong appeal to the continent that going alone will not help the individual cause for the country, but we need to do it collectively. There is really this African saying that if you want to go quickly, you go alone, but if you want to go further, you go together. So I think we are aligned with that philosophy of going further, but going together as a whole of a continent.
Related to that, one from Elizabeth Merab from the Nation Media Group in Kenya. And she's asking, are there countries that have submitted requests to be considered for procurement and eventually to start vaccination? And then another one from Kana Ara from the Associated Press. She wants to know if there are any individual member countries that already made deals for the COVID-19 vaccines.
Individual countries in Africa that we are aware of, I don't know. It doesn't mean they are not discussing. We have only read in the media that some countries are engaging with individual manufacturers. I think, but at the level of officially engaging with us, we are not aware of that. With respect to individual submissions to the COVAX mechanism, I don't know. I would like to engage with COVAX more in a more structured manner, so that when countries go to the COVAX and submit that request, we are aware of that and we can help the countries roll that out, because there are so many complex issues that need to be still dealt with, like regulatory issues. Do we use a single and harmonized approach for regulation to put a stamp of approval on those vaccines that will gain access to the continent? We should really remember that we are dealing with a very complex issue here, which is to say if we do not handle the vaccine access and distribution appropriately, it might have consequences on other vaccines there. So that is where Africa CDC, the WHO have come in hand to be sure that there's coordination around the messaging, there's coordination about and speak to what the vaccines are, which vaccines will be accessible and which countries are having the vaccine in a totally transparent manner, so that everybody has access to the same information at the same time.
And Kara Anna also wants to know that you mentioned that the number of cases in Ethiopia is decreasing. She wants to know if this could be linked to the security situation in some parts of the country.
I think that that is a good question that unfortunately we don't have that analysis yet, and we will continue to work closely with the government of Ethiopia, specifically the National Public Health Institute, to look at the trends by region to see if that is the case. So, in other words, it would need to be that we understand that if most cases were coming from the area that is affected, and then we don't see cases coming from that area, then it might actually account or explain why we are seeing a decrease in the number of cases. But again, I would hesitate to be speculative there and just wait to see the real data.
Another question from Elizabeth Merab, and she wants to know what is the soonest that we will see an African country start vaccinating its population?
I think it all depends on the arrangement that with the countries and deals that they made with COVAX. Remember that the COVAX had individual deals with countries, I think. But again, to respond to that at a more higher level, my appeal to COVAX and other bilaterals is that for those countries that have excess vaccines, and some countries have bought like 3 times to 4 to 5 times more than what they need, to really repurpose those and bring those to the COVAX facility, or work directly with countries and begin to make them, enable them to start their vaccination program. So I cannot put a timeline as to when the vaccination will start, but again, I'll say this, it will be an extremely unpleasing view to see Africa stall and not be vaccinating and witness the whole world vaccinating. I think that will become a moral issue that we have to be very, very careful with. I think my appeal to those who have acquired more and excess vaccines is that let's sit down around the table, maybe through a UN mechanism or a special session of the UN, and just really have an open, courageous, and open dialogue that will establish trust, that will establish the credibility, and that will speak to all what we have been saying at the beginning of this pandemic, that we need to show global cooperation, global solidarity. The time for that is now. The time to translate those powerful words to action is now.
We have two questions from Pamela Kumba from Channel Africa. She said, the first one, she says, I've read that Pfizer BioNTech's vaccine and Moderna's vaccine, they use bits of genetic code to cause an immune response. How safe is this? Does it not alter human cells? Then the second question is, do we know how much protection vaccines might give in terms of stopping people from spreading COVID-19?
So what Pamela is referring to is the so-called the messenger RNA. And the messenger RNA is this piece of genetic material that will enable a gene, the genetic material to develop a protein. And it is that protein that the immune system in the body sees. Okay, your white blood cells will see that and develop a reaction then. And a reaction that will have memory. Okay, so that if you are subsequently exposed to the virus, they react in a very aggressive manner. So the messenger RNA there by itself is not it's not a virus, it's not infectious. It is there just to coat that protein. And what we call it, you call it in lay terms, manufacture the protein. And in biology or immunology, they call it you coat the protein. So I think that the messenger RNA itself is not going to integrate into the cells of the body, so it has no harm. So remember that studies have been done to ensure safety extensively through phase 1, phase 2, and phase 3. Phase 1 studies are designed to test just a small number of people, just a handful of people to determine if the vaccines are safe. Phase 2 is where you continue along the same line of safety and where you expand the number of people. And phase 3 is where you truly look for efficacy and additional safety data on a large number of people. And if you recall, I think the Moderna vaccine and others, they were using up 30,000 participants. And in course of that trial, you all observe safety. And none of that has been reported. So I think I want to assure the population that these vaccines are safe. It's not the first time that we're dealing with using vaccines. I think personally, I've actually had about 7 different vaccines growing up, including the polio, the yellow fever, and all kinds of vaccines. I think that vaccines are the most potent weapon that we have in public health in the history of infectious diseases. In terms of protection, what we know is that these vaccines protect. We don't know how long they will protect. In other words, are the vaccines going to be like the common cold vaccines, which we tend to get them on yearly basis, and that is informed by the genetic changes that occurred in the common cold viruses. So there will be a need to continue to study these vaccines in what we call the phase 4 trials. That is, people that are vaccinated, for how long would their immune system continue to be alert and to fight subsequent infections. So based on that, it would tell us if this vaccination will be yearly, bi-yearly, or whatever. I think with that answer, we don't know for now. And so that is why research will continue to be useful in understanding this parameter.
Another follow-up question from Sarah Javin of Devex. She said you mentioned that if not done properly, a vaccine rollout could have an impact on other vaccines. She wants to know what you mean by this. And she's asking if there is any concern that this could increase anti-vaccine sentiment.
So let's admit it that there's a huge movement out there called the anti-vaccine movement, and we have to address it squarely. We cannot wish it away. We have to focus our energy there and find ways to continue to assure the community that vaccines are safe. And that is why it was very important very early on when we started doing the vaccine perception survey to account for that. And we did that at scale. We did that with 15 countries. And again, in the coming days, we'll be able to discuss the results with you fully. So what I meant is that we should really approach the COVID vaccination with total transparency. Transparency with respect to address the community questions as much as possible, as we are doing now. Be very explicit to the targeted community what it is that the vaccines, especially the new concepts of the vaccines that have been introduced, like the messenger RNA vaccines, so that we continue to establish trust or strengthen that trust with the community. Because if the community, if the trust factor suffers, then it will spill over into the routine vaccines that we take every day. I think that is what I meant by handling it well, so that there is no spill over in respect to misinformation or total distortion of information that will affect the routine vaccines that we normally receive.
Of BBC. The first one, she says, is the Africa CDC aware of Morocco's intention to start mass vaccination using the Sinopharm vaccine sometime this month? Has this particular vaccine completed advanced trials to prove it safe and effective? And has the vaccine been approved for emergency use in other countries? Then the second question is, you mentioned that the Africa CDC is working with the World Bank, Afrexim Bank, and the Africa Development Bank to get vaccines for the continent. Will this support be in form of grants or loans?
So with respect to Morocco, for that particular vaccine, the only information that we have for that vaccine is that that has been generated from the United Arab Emirates. I think it's just yesterday that we read about the vaccine, the efficacy of the vaccine. I think that they just completed a phase 3 trial there. For Morocco, we've written to Morocco officially initially our understanding was that it was a clinical trial, not necessarily a vast immunization. So we've officially written, as a member of the African Union, a note verbal to Morocco and Egypt to try to understand what is going on in respect to the vaccines that they are using. We will be issuing guidance in the coming days with respect to how countries should approach vaccines if they do it silo, if they do it individual. I think we are keeping all the options open. We are 55 states. All we can do is to say coordinate through us. But if countries want to do work silo, we'll be giving them guidelines on with respect to safety. What should you be looking at safety? What should you be looking at efficacy? And how should you be preparing to roll that out? And we focus on the house. How do you roll out a vaccine immunization program for COVID-19? So that's all I can say with respect to that, the Morocco issue, and based on the information that we have.
And then we have another question that will come from Sophie Mukwena.
I just want to find out, how are you going to deal with the issue of vaccine nationalism, a rush or a scramble for vaccine, particularly by those developed countries? We know that they have already placed orders of large quantities. How are you going to ensure that Africa is not left behind? And also, with America having a new administration, or going to have a new administration, and President-elect Joe Biden having indicated that he would rejoin the World Health Organization, are you optimistic that America rejoining the World Health Organization will assist in a global coordination in terms of fighting this virus?
I think, let me start with the second question. And answer it this way, that America's leadership in global health has always been instrumental and has always been defining in times of need, especially for the continent of Africa. We should always remember that through the PEPFAR program, the President's Emergency Plan for AIDS Relief, which started in 2003, over $90 billion have been invested on the continent for treatment and prevention of HIV/AIDS. So I think I use that point of reference to say that we as a continent have always been grateful and benefited from the leadership that the United States the people and their leadership have exercised. So we expect nothing short at this critical junction where we find ourselves as dealing with a pandemic that requires an effective vaccine and potentially an effective treatment. I think that's the way I look at it. And we recognize some of the narrative that we are hearing from the Biden President-elect's administration. We are very encouraged of the warm words that we are hearing about engagement with the World Health Organization. But with respect to vaccine nationalism, this is what I'll repeat this, that the moment we have all been talking about global solidarity, global cooperation, and the ethics of vaccine is now that the vaccines are there. And it is my appeal to the United Nations to really summon a special session to discuss vaccine timely and ethical and fair allocation, so that the world do not look confused, and so that the world do not get into a mode where we begin to create this north-south distrust with respect to access to vaccines, which is supposed to be a common good. We know that COVID will not be defeated in the West alone, that COVID will be defeated all over the world, including Africa, a continent of 1.2 billion people. So I'll go ahead and continue to make an appeal that a special UN session needs to happen so that we put everything on the table and discuss boldly, courageously, to the extent that if the discussions are uncomfortable, they are uncomfortable, but that's how we come out strong as a people living on the same planet. I think if failure to do that will get us into this dialogue of suspicion, and where we do not have trust, and we need trust capital to win this battle against COVID-19. Otherwise, we'll be in for much, much longer time.
From Sam Eferaro of Africa Health Times is asking, how will you react to some messages on social media, supposedly from scientists speaking in the inherent dangers of vaccine, COVID-19 vaccine, and discouraging people from accepting it?
So it's very unfortunate that, to say the least, that people that come in with what is perceived as credentials to be mobilizing the community against COVID-19 vaccines. My reflection is that you trust your public health agencies, trust the Africa CDC to give you the right information, trust the World Health Organization to give you the right information. These are not organizations that are out there so these are organizations that are out there to watch out for the safety for this vaccine, because what is at stake is huge. The principles behind vaccinology is simple. It's the same principle that we've used over the history of vaccinology, be it for measles, for TB, for flu, for cholera, for all the vaccines that you and I have taken. Again, as I keep reminding people, personally, I've taken over 10 vaccines in my lifetime, and I'm healthy. And just to address that question, I'll say, if there was a vaccine today in Addis Ababa, I would be driving right there to that vaccination point to get my vaccine. I'm a virologist and immunologist for 32 years, so I know what I'm talking about. I'll go get that vaccine without hesitation. So it is really unfortunate that we continue to see those videos circulate and then they are propagated. I will ask that we just to conclude on that question, that we all take on our own collective and individual accountability and discipline, that we do not forward those videos when we receive them in our different WhatsApp messages. It's distorting. It's extremely manipulative, because they know that when they have such videos, people will circulate it and they will just continue to replicate like a virus. I think we should try to stop it. I mean, we should say to ourselves that I'm the last person to propagate false information by not sharing that video.
And then we have another question from Addis Getachew of Anadolu Agency. He is asking, how many doses of vaccines do you think Africa will need? And what segments of the society should be given priority in terms of vaccination for COVID-19?
So as a continent, if we strive to get to 60% of immunization, so 60% of 1.2 billion people will place us around 750 million doses of vaccines. And you also always have to factor in the loss. I mean, there will be vaccine loss, where when people open vials, they don't store it well, they don't use it anymore. And you also consider that we need 2 doses of those vaccines to complete an immunization course. So you get a first dose, which is what we call the prime, and then after a month or so, you get a second dose to boost your immune system. So we'll be looking at about 1 something billion doses of the vaccines to achieve our stated target of 60% vaccination. I think that's what what that 60% means for our continent. And we should always know that about 5 to 10% of vaccines will be wasted. That is not used properly.
Okay, and quickly we have 2 related questions, one from Dingani Masuku and another from Andrew Meldrum. The first one is saying, which vaccine is likely to reach Africa first and when? And then the second one says, has China offered its vaccines to Africa?
I think it's difficult to say which vaccine will get to the continent first. We are very open to vaccines that have been approved through the WHO mechanism. Say, for example, if Moderna says they are ready to supply us the country X with vaccines, and as I stated earlier, we shouldn't just say, well, you need a minus 25 degrees Celsius. We should say, well, if we get a Moderna vaccine, we can start vaccinating in your capital cities, and you put minus 80 or minus 20 deep freezers at multiple sites and start vaccinating. And that will allow us time to start vaccinating while waiting for the newer versions of the vaccines to arrive. The pipeline for vaccines looks very encouraging. I mean, COVID vaccine looks very, very encouraging. So who knows, in the next 2 weeks or 3 weeks, other trials may show that other vaccine constructs are giving us the same results, and they require less stringent conditions for storage and transportation. So the key there is to start vaccinating and in your major cities, and then have plans to roll it out as new versions and more adapted versions of the vaccines are made available. With respect to China, as I said earlier, we are in discussions with the government of China. China is also talking to individual countries. We all encourage that such dialogue should go through the Africa CDC and the African Union. We encourage that countries should also defer such discussions to the Africa CDC and the AU for coordination. The EU and the Africa CDC is a member state instrument created by member states, so they should really be using these instruments to engage with their companies so that we truly have the whole of Africa approach for these vaccines acquisition.
Yeah, actually, we've come to the end of this briefing today. But just one clarification on the question from Rhoda Odiambo. She wants to know if the support from the banks are going to be grants or use. And then from there, you can give us a final word for the briefing.
No, absolutely. I think from the banks, it will be a combination of the loans, grants, and other mechanisms. I think it will all depend on the specifics with which bank we're dealing with. I mean, the Afro-Exim Bank, of course, and their promissory notes, their long-term concessional loans, and stuff like that. I think there's also the World Bank, as you know, has put out $12 billion, and we are working with them. As of yesterday, we were in extensive discussions with them just to discuss exactly that. So it will be a combination, in my view, of both. Just my closing remarks is that as we really go through the holiday season, there's a real risk that we'll see the infections increase across the continent when we come back in January and February timeline. I think it is therefore a collective responsibility that at multiple levels that the political leadership continue to increase a campaign for mask wearing massively. As I move through the continent, it's unfortunate that I see clearly signs of prevention fatigue. People don't wear masks enough, or they don't wear it correctly. They actually carry it, but carry it poorly. I think the authorities need to do something there, because we approach a very, very sensitive period, which is the holiday festivity period. Then the individual citizens have to really say, well, these are times that are unusual, unprecedented. As we go into the festivity season, let's be sure that we protect ourselves and protect our loved ones by doing the right thing, which we all know I've discussed here over and over. So I think that is what I mean. I'll end at that, and just wish you all a wonderful week and a wonderful day.
I'd like to thank everyone who has participated in the briefing today. So next week, remember, there will be reports of the vaccine perception survey that was conducted in some member states, and we hope to see you then. Thank you very much and have a nice day.
Connect to the other one. Because they're already on. This is 2 minutes past. I thought you told James to make it short. Were you not reminding him?